afternoon. I'm Michael McGinnis from the National Academy of Medicine, and it's my distinct pleasure and privilege to welcome all of you here, to thank you for joining us this afternoon for what we feel is an occasion that's of basic importance to the progress in health and health policy for Americans. And in fact, it's unusual in many ways for us in the National Academy of Sciences, Engineering, and Medicine to be able to bring to bear through our convening and assessment capacity the best science to address an issue whose tentacles extend so widely into fundamental policy challenges. Clearly, when we look at the costs of care in this nation, nothing typifies the opportunity to develop a more efficient system than the issue of treatment of high-need patients. When we look at improving outcomes for individuals who are at highest need, the definition of this activity is aimed at those who are the most vulnerable in our society and for whom the opportunities are so great. And when you consider the possibility for science and evidence-based assessment to identify basic ways in which systemic reform and to engage and bridge activities across sectors in order to improve the conditions for these vulnerable populations. And those efforts to bridge sectors will redound not only to the benefit of the targeted patients, but indeed to the operation of the entire system. This is a very unique opportunity for the National Academy of Medicine. So we're very grateful to be here to announce the release of the National Academy of Medicine special publication, Effective Care for High-Need Patients. This publication is the result of a series of National Academy of Medicine workshops that were held in partnership with colleagues in other elements of the healthcare system, with the Bipartisan Policy Center, with colleagues at Harvard, and through the coordinative leadership and initiative of the Peterson Center for Healthcare, which I'll mention in just a second. And many ways beyond those initial partners extended to a robust partnership with foundations from other aspects of the health leadership in the nation: the SCAN Foundation, the Commonwealth Fund, the Hartford Foundation, the Robert Wood Johnson Foundation, who are also represented here. So this is a true partnership engaging one of the most vital issues facing Americans today. You're going to hear a summary of the report in a bit, but at the outset, I'd like to give specific thanks to many of the key players involved, not all of whom, but many of whom are fortunately here with us in the room. Before doing that, I'd like to, of course, acknowledge the staff who have engaged and implemented the day-to-day work. Danielle Witcher is here as the Senior Program Officer. Maria Dahlberg was her predecessor, also here. Katie Lewis-Apton, Gwen Hughes, who's been on the front line all along for us, each of whom has contributed mightily throughout the course of the work. It's also important to emphasize that those contributions were guided so expertly by a planning committee, an extraordinary planning committee, who are listed in your materials and who we'll reference later on, and a planning committee that was guided by an extraordinary chairperson, Peter Long, from whom you'll hear in just a bit. This was an effort that was complicated, dealing with issues that not only important, but have so many dimensions to them that the work of dozens of people from around the country, indeed I should say hundreds, ultimately had to be pulled together and forged into the kind of important insights that you'll find in this report. So very special thanks to the Planning Committee and to Peter, and of course to the Peterson Center on healthcare for the support of the project and for the initiative and leadership that they provided to try to identify innovative solutions to improve healthcare quality, curb spending, and expedite the spread of these solutions on a national scale. You're going to hear from the head of the Peterson Center, Jeff Selberg, in just a minute. Also with him today from the center are Emily Zaborowitz, Jorge Alde, and Kayla Zachgendler. Kayla, I apologize if I didn't get that quite right. This is the first time I've met her. But you're sitting next to the other Z person at the foundation, and you make a terrific duo, I can tell already. One area of significant focus for the foundation is improving the care for high-need patients. Jeff and his colleagues have been leaders in working with partner foundations in this respect. We'd like to commend and thank and offer a strong measure of gratitude to Jeff for your leadership and vision in this respect, and not only for the commitment to the issue, but for the commitment to ensuring that the efforts undertaken were collaborative in nature. When we look at the fundamental nature and the complexities of this issue and the various perspectives and resources and loci of leadership that have to be brought together, it's the only way to engage this issue. And your commitment to do that in a formal way and in an informal way throughout the process has been extremely important. And you have also locked arms, I think, really beautifully with the SCAN Foundation and RWJF and Commonwealth Fund, Hartford, and other colleagues. So in addition to introducing you and inviting you to the podium, I want to thank you very much.